Yes, good evening, everyone. Welcome to the webinar today. We are going to be learning about the mental health awareness. It's the awareness month, which is normally marked in May. And Madare, in collaboration with KNH and UON, are running these webinars. There is a series of webinars that are going to be run in the next few weeks. And so we encourage that we all come in to participate. And today, because I can see already our time has started, my name is Memphis Kamanda, and I am a clinical psychologist at the Madari National Teaching and Referral Hospital. And I am going to be moderating our speaker today. And I welcome you all. As you know, Madare National Teaching and Referral Hospital is the epicenter for mental health. In fact, in the community, if you ask around, you will hear them say mentor, short form for mentor. So I are stigmatizing, but at least that shows that we are the epicenter for mental health. And the speaker today is that person who you can refer to. Like I think the queen pin of mentor. She is Dr. Mercy Karanja, a consultant psychiatrist, and she has over 14 years of experience in mental health practice. And currently she works with the Ministry of Health, and she has been the head of clinical services at the Madari National Teaching and Referral Hospital. Actually, she was my boss. She is the one who interviewed me for the job, and I'm glad I got it. Today we are presenting together. She's a member of the Kenya Psychiatric Association, and she's serving as the National Executive Committee as the treasurer. She sits in the board of directors of NACADA, where she represents the Kenya Medical Practitioners and the Dentist Board. So if you meet her, you may not think that she's the one, but yeah, she's going to be the one. And today she's taking up that role of enlightening us on understanding mental health and the things that we're going to be debunking. So without much ado, I think I'm going to start the share so that I welcome Dr. Mercy. And if she has anything to say, she can say that as we all learn together on this rarely spoken or rarely thought of topic of mental health. Thank you so much for that. So, Daktari, I am welcoming you so that we can start.
Thank you, Memphis, for that introduction. And thank you for the organizers for making this possible. Thank you, KNH and UN for hosting this webinar, and all our partners who are participating in this month of May mental wellness. So for those who have joined the meeting and maybe are not aware why we are doing the series of webinars, May is Mental Health Awareness Month. And one of the things we are doing as the mental health advocates and mental health policymakers, mental health stakeholders, we've come together to educate the public about the importance of taking care of their mental well-being. And we'll be having a series of webinars and other events which we shall be inviting you to come and participate in, all in the with the purpose of educating people about their mental well-being, and also how to seek help in the event that you have mental health problems. So today, being the first of a series of webinars, I'm going to be laying the foundation of the series of webinars that are going to come. So for some of you who may have come and you're expecting to hear about how to manage some of the mental health conditions, please don't be disappointed. This is the first of many webinars. And this one, I'm just going to lay a foundation to just let people know what really mental health is, because there's a lot of misunderstanding on the concept of mental well-being, mental health, mental illness. And we decided to start here so that people can get a feel of generally what are we talking about when we talk about mental health, mental illness, and mental wellness. So up to the you can move my slides, Memphis, to the next slide. So the outline of this webinar, I'm going to be speaking on some definitions of terminologies generally what health is, what mental health is, and mental illness, and why we need to stay mentally healthy. Then we'll explore why are we talking about these subjects, if at all. Then we'll talk about some of the warning signs of mental ill health, and we'll debunk some myths. This is, like I said, the first of many webinars. So you'll hear in the subsequent webinars, our presenters will even talk about common mental health conditions, how they present, but this may not happen here. Maybe we'll just have a broad overview of how mental health conditions may appear. I'll begin by stating something that lays a foundation of us defining mental health. And I start by defining what health is in general. Our target audience for this webinar is not just medical practitioners or healthcare providers, it's also the general public. Therefore, I want to start with the very basic fundamentals so that you can all be on the same ship. So when we talk about health, the World Health Organization defines health as a state of complete physical, mental, and social well-being. Please note that mental well-being is also included in the definition of health. So it's not just about your physical well-being, it's also your mental well-being, your social well-being. And further goes to say that it's not merely the absence of disease or infirmity. When you talk about holistic health, as you can see from that holistic health model displayed there, we are talking about all aspects of an individual, their physical, their social, their mental, and their spiritual well-being. And we must address all these things simultaneously if we are to ensure that people remain healthy in total. If you address one area and you leave out the other, then the person may not be able to realize full health. So we often say there is no health without mental health for the reason that health in its whole definition, it concludes or incorporates the wellness of the mind as well. Well, as Mahatma Gandhi said, health is the real wealth that we possess. It's not the pieces of gold or silver that are real wealth. Our health is very important, and therefore our mental health is very important. It's a resource for everyday life. It's a resource for us to be able to live and socialize and make a meaningful contribution to our society. So health is a resource to support an individual's function in the society rather than an end in itself. So when we are looking about being healthy, just because your body is not aching, but your mind is in distress, then you're not able to function in the wider society. So our health is very important. Our mental health is also our wealth. So is our physical and social well-being. Now, on to the next slide. Now, we go to the real matter that we're handling here, mental health. A lot of people confuse, and it's in common conversation, you'll hear people talk about mental health. Huyu akona mental health, but by that time they are meaning somebody with a mental health condition or illness or problem. Yet mental health in itself is something different from just mental illness or absence of mental illness. So when we talk about mental health, WHO defines it as a state of well-being in which an individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. Please note it says ability to cope with day-to-day stresses of life. Stresses are supposed to be there in our daily living. They are there because they're the ones that push us to achieve what it is that we want to achieve in our lives. They are part of our living. The ability to cope with those normal day-to-day stresses actually define your mental well-being. If you're able to cope with them, then that means you're mentally healthy. If you're able to interact with others positively, work productively, and realize your full potential, then that defines you as a person with mental health. But remember, it's not just the absence of mental illness, and it's more than just feeling happy. I've seen several images shared of some of the famous comedians who perhaps died by suicide, but they were entertaining people and making people laugh, and in themselves, they looked very happy. But the next day you hear they have died by suicide. Mental health is more than just feeling happy. And mental health is more than the absence of mental illness. This means that somebody even who suffers from a mental health condition, they can still enjoy mental health. And I'll describe that in the subsequent slides, what I mean by that. It is important to take care of our mental health because when you have good mental health, then you're able to enjoy your life. You're able to realize your full potential. You're able to cope with stresses that are normal in the day-to-day living. You'll be able to work productively and contribute to your society in various ways, including your family, where you live, your neighborhood. And you're able to have a sense of inner peace, think more clearly, and be able to improve your relationship with others. Somebody who has good mental health also, they're able to increase their self-esteem. And to some extent, person who enjoys good mental health has also been found that they are able to fight illnesses, other physical illnesses. You'll hear people often saying that when I'm stressed, I easily catch a flu. When I'm heavily stressed, when I cannot cope with the stresses, I easily catch a flu. I feel sickly. It has been found and scientifically proven that indeed depression and other mental health conditions can lead to a lowering of your immunity and subsequently predisposing you to other physical illnesses. So when you have mental health, then even your physical health can easily be safeguarded. When you're not mentally healthy, you're also not able to take care of your physical well-being. So mental health also influences your physical health as well. Next slide, please. So how would you know if you have good mental health? There's really it's not like your body temperature where you can take a thermometer and measure that today my mental health is at this level, or how you can take your blood pressure and say, my blood pressure is normal or not normal. But there's a way you can tell that you're enjoying good mental health. And there are many ways, but some of the ways you can tell is when you're able to cope with stress and adversity. So you have what you call emotional resilience. Yes, the stress will come your way. All those things will follow you from your interaction with other people, from your workplace, from family, from day-to-day activities you must undertake. But you're able to cope with them. And even when there's adversity, you go through the normal reactions, but then you're able to bounce back and express your emotions in a various range. It's not just the extreme of emotions. You know, if you find that you have had a sad situation and you're able to express the sad emotions at that time and then bounce back when you've coped with that sad experience, then you're experiencing a range of emotions that are suitable to that event and therefore displaying emotional resilience. Positive mood. If you have a positive outlook on life, no matter what it throws to you, and not just being a regular Kenyan who says tumezoea, but more like having a positive outlook and being able to enjoy activities that you like and regularly participate in events that you like and saying, I'm going to move on with my life because this is my life and I need to enjoy it. That is a sign of good mental health. Self-esteem, having a positive sense of self-worth and being your number one cheerleader, being able to enjoy good relationships with others and set healthy personal boundaries. Then being able to self-care and self-love by being able to prioritize your own well-being, engaging in self-care activities and practicing healthy behaviors. And of course, productivity. One way of measuring your mental wellness is your productivity in society. If it's school, your performance, if it's at work, if it's at a family level, if it's a social level, your productivity and meeting your goals and achieving your potential. So you're able to set the goals and meet them, or although you may not be able to meet all of them, but at least meet most of the goals that you've set. Then health help-seeking behavior. A person who is mentally healthy is a person who recognizes when they need help. It's not a sign of weakness that now I'm weak, I am not okay. It's not a sign of weakness to have help-seeking behavior. If you're able to recognize that today I'm not doing well, I need to speak to somebody, then that means your mental health, you're alert to your mental health wellness. So these are among many things that a person with good mental health will display. So some people ask, now that you've talked mental health and we keep saying mental health, when we are referring to people who are mentally ill. So there's a difference between mental health and mental illness. So when we talk about mental illness, is when we are describing a condition, a health condition that affects a person's emotions, thinking, or behavior. It is when somebody has moved away from the normal now, or the healthy mental health space, and gets a condition that changes the way they think, it changes the way they behave, and even their emotions, and they're not able to regulate them. Often somebody with a mental illness will also suffer from distress and will have problems, may have problems functioning in various areas, be it socially, at work, or at family level. So for it to be called an illness, it has to reach a point where it is actually distressing you and making you not being able to function socially, at work, or at family, so you're not productive. So those three aspects, your thoughts, your emotions, and your behavior is what is affected when you have a mental illness. There is a way that we are able to classify a mental illness. Some people ask, is stress a mental illness? Like I said earlier, stress is not a mental illness in itself, but if it is prolonged and it's, especially the negative type of stress that we call distress, it can lead eventually to mental illness. And so when we compare mental health and mental illness, as you can see from here, mental health is your general state of well-being. It's a state of mind. So from now onwards, when you're moving around, don't be telling somebody who has a mental illness that, oh, you are on a mental health, because it's a common pronunciation that is misused. We all enjoy mental health, but some people, when they're suffering from mental illness, it means their mental health has been disrupted, right? So mental health is when your general state of well-being and the state of mind is okay, and it's something that you need to look after and make sure it stays okay. Mental illness is something that now disrupts your mental health state and now interrupts how you think, communicate, or behave. If you look up at the image there, mental health is a continuum. There are some people who will be excelling in the green area, and then they are thriving, but then sometimes they start struggling. And just like a speedometer on the gauge of a vehicle, sometimes somebody can swing on the extremes. And that is why in the definition of mental health, we say it's not merely the absence of infirmity. It's not merely the absence of disease. Why is that? Let me give an example with any other common health condition, like, for example, diabetes. Somebody who has diabetes, it is usually diagnosed when their blood sugar levels are high beyond the normal. So when your blood sugars are high beyond the normal, the doctor will diagnose you with diabetes and put you on medication. When they put you on medication, it is supposed to make your blood sugars go back to the normal levels. When they go back to the normal levels, you go back to living normally, all right? As much as you have diabetes, you're enjoying health because you have followed the doctor's advice, you've taken the medication. If it's diet, you've taken the correct diet. If it's exercise, you're exercising. And therefore, you enjoy health despite living with diabetes. So it's a similar thing with mental illness. So people can be in crisis, in the red zone, and at that point, they have a mental illness that is actually disrupting their mental state and their normal functioning. But then they seek help, or they are offered help, and they can move back to excelling if they follow what they are advised or what they are put on, a person with mental illness can still enjoy mental health despite living with a mental health condition. And this is where a lot of times we get lost by assuming that people with mental illness cannot enjoy mental health. They can and they do. And we'll talk about this more as we are dispelling some of these myths. Let's continue. So again, still talking about the continuum of the mental health continuum. And there are some people who never reach the red area. There are people who just, most of their life, they will enjoy positive, good mental health. And sometimes they may move because of the daily stresses of life or different life experiences as exposures. They may swing as if they are going towards the red zone. But then there are some people who will just go to the amber or yellow area and then swing back to positive and healthy mental health. So mental health can be seen as a continuum, ranging from having good mental health to having mental illness. One of the things that people need to be aware about is that there are very many mental illnesses. The same way, if we were to go to the chest, for example, there are many health conditions that can affect your lungs. There are many health conditions that can affect your heart. If you go to the abdomen as well, there are many health conditions that can affect various functioning of your gastrointestinal system. So the same way with mental health, there are so many conditions, over 400 have been classified. However, we tend to stereotype mental illness to be just to narrow it down to a few, like the depression, psychosis, substance use disorders, maybe manic depressive psychosis. But there are very many disorders. Of course, there are the common ones and there are the rare ones. So we need to know that people can actually swing in the end, and does not necessarily mean that everybody who finds themselves in the red part of this mental health continuum will have to be put on pills or drugs or put in a ward. There are various interventions that are in place that don't necessarily involve medication. And you'll find that people who do not swing all the way to the red area do not even necessarily require medication. They are the psychosocial and psychotherapeutic interventions. So we need to be alert to our own mental well-being so that we can know when we are going towards on which side of the continuum we are. It is usually often said as a joke by some people that everybody has their mental disorder. It's just the degree that matters. I wouldn't put it that way. I would just say that really is that it's a continuum. And sometimes people can swing and get to the red zone and then go back fully to the green area without ever having to return to the red zone. So it can be a one-off event that never recurs. It could be an event that is still there and keeps, depending on the different environmental factors, social factors, biological factors, it can swing on either extremes. However, help is available. So let's continue, Memphis. Again, just emphasizing so that people can be alert to the fact that people do live healthily, even when they have a mental illness. If you look at this quadrant where when people have mental health conditions, there are those who will have poor mental health because of their mental illness at some point in their life. Then there are those, once they get attended to, despite having a mental illness, they enjoy good mental health. So on this side, on the upper side is the side of high mental health. So you can still have good mental health despite having a mental health conditions. You can also have poor mental health even without a mental illness, all right? But most of us, of course, always strive to be in this area of good mental health without a mental illness. But remember, you can swing in any way. And always remember that even persons who suffer from mental illness can also end up with good mental health if they get interventions and the help that they seek. Next slide, please. So this is a question that's always asked. So because they are mental illnesses, of course, what causes them? Is it something that people have been bewitched? Is it because you crossed the road at the wrong place? Is it because of there are all these beliefs and myths that are there. What I can say is that there isn't a single causative factor that you can pinpoint to and say, this is what caused your mental illness. So when people come to hospital or when they go to see a mental health care provider, there will be so many questions that will be asked because we are trying to make a case and understand what could be the underlying cause of your mental illness, because it's a combination of factors. And we often use what we call the biopsychosocial approach. In the biopsychosocial approach, we understand that mental illness are caused by an interaction of various factors. And those factors include biological factors. Biological factors, we are talking about the things within a person that are either within their genetics or maybe from their own other physical health conditions or the use of substances. I may give an example. People who have, when you talk about physical health, people who have like thyroid disease may sometimes, depending on whether the thyroid is overworking or underworking, they may display either depression or manic symptoms because of the thyroid problem. People who have had a head trauma, maybe you had head injury, you could end up having some complications that will manifest in with mental health symptoms, mental illness symptoms. Then on the social aspect, also, again, the social experiences and social exposures, you could be genetically predisposed, but then you have good social and environmental factors and psychological factors, and you never develop mental illness. So you could have genetic vulnerability, but because the other areas are safe, you don't even ever develop mental illness. So again, psychological factors, social factors, an overlap of all these contribute to the occurrence of mental illness. So don't go to the doctor and ask, I want to know, is there some genetic test that you can do that will directly link my condition to this? Is there a blood test that specifically? So we will do those laboratory tests because they'll also help us see, is there an underlying physical condition that could have contributed to your mental health symptom, mental illness symptoms, or any psychological problems you're having. We will ask you about your family background because we want to understand, how was your childhood? Have you had traumatic experiences? Have you been having problems at work that may predispose? Is it money issues? Are you using drugs? Are you using alcohol? And you see, these overlap. People could be using drugs because of psychological issues they are coping with or social issues, and in total, it ends up with mental illness. So we can go to the next slide. And often we'll talk about risk factors and protective factors. So people who, when we talk about risk factors, it's things that put you at a higher risk than other people. You're more likely to experience a mental health problem if you have some of these. One, having a history of mental illness in a blood relative, especially when it comes to a parent or a sibling, brother or sister. You may find, and that is why you may find in some people say, ile familia imerogwa, that family is cursed. It's not a curse. It's just because there's some genetic predisposition. If you have extreme stressful life situation, especially if you have another underlying risk, then there's a possibility that you could easily have a mental health problem. People with ongoing, especially chronic medical conditions. For instance, somebody who is going through a treatment for cancer, and they are not able to cope with the stress of being diagnosed with cancer, they could end up having depression. People with, like what I stated, there are some hormonal conditions that you may have that because of the hormones being released in your body excessively, you may develop what we call anxiety disorder because of the hormones being released in your system by another ongoing medical conditions. Brain damage, especially when it's severe, you might find that some people, when they experience maybe an accident, it may cause them to, which injures their brain in one way or the other. Maybe some people may manifest some mental health problems interference with either their behavior, their emotions, their way of thinking, because maybe a specific area of the brain has been damaged that controls that particular function. Traumatic experiences, and in our subsequent talks and webinars, you'll hear about post-traumatic stress disorder, something that happens when people have experienced extremely traumatic life events, either themselves or observed other people doing it. The use of drugs and alcohol puts you at a high risk of having mental health conditions. Excessive use of alcohol, the use of drugs, this can put, and it's not just excessive. So for some people, even just a single use of drugs can actually cause them to develop psychological symptoms or mental health symptoms. Then childhood history of abuse and neglect. And that is why we emphasize on childcare and nurturing of children. This can be carried on into adulthood and result in mental health conditions. Having poor relationships and previous mental illness also puts you at higher risk. We can carry on. Of course, there are things we like to tell people that you need to identify your risk factors. And if you're at risk, you need to protect yourself. So, and not just those who are at risk, everybody, you need to protect your mental well-being by identifying the protective factors from some mental illnesses. One is having good social support systems and good relationships. Sometimes you may have a relationship, but they are not supportive. So the key word here is supportive relationships. Having a sense of belonging, either through a community or cultural connectedness, some sense of connections, having the environmental factors where you live, where how your family is, how your community is, and even your own personal resilience also helps you to be protected from some of the adverse mental health problems. Can move on. We'll talk about this more when you're talking about the causes, how to remain mentally healthy and well. So as I said earlier, these are some of the biological factors, like what is in your biology, what is within your body, what is in your physical body that can lead you to have now mental health problems. Of course, I've already talked about the genetic risk when it runs in the family. Some infections, especially when it affects the brain. You've seen people who have malaria and they develop symptoms that people will call it cerebral malaria, but it's because the pathogen that causes malaria has gotten into the brain, or maybe because of the reaction of the body trying to safeguard itself, it causes you to be in a state where you call delirium. So some of these infections, or even direct brain infection, like with meningitis, brain injuries and defects, as I talked about earlier, even people who have suffered stroke can develop some mental illness if some certain areas of the brain are affected. I'm not saying that everybody who gets those infections or those brain injuries manifest with mental health problems. I'm just saying they may cause or they may exacerbate mental illnesses. Excessive use of alcohol and drugs, some brain tumors, exposure to some chemicals for long, and toxins. I know there has been a lot of talk about lead poisoning and what it causes to the body. It can also affect the brain. So exposure to some chemicals, maybe from where you work, where you live, or what you eat. Aging. With aging causes changes in the structure of the brain. Some of you may know about a condition called dementia, which is a condition that is often seen in persons who are of advanced age beyond the age of 65 years. It's not a condition that always occurs with age. No, it only occurs to people who are at risk. So that is associated with changes that occur in the structure of the brain. And also what we eat, poor nutrition. You may just think a child who is poorly nourished, an adult who is poorly nourished, they'll just experience physical stunting. But we need those micronutrients that are found in food for proper functioning of the brain. So if there's poor nutrition, either undernutrition or overnutrition with the wrong kind of food, it can also predispose to mental illnesses and mental health problems. Psychological factors, again, emphasizing the personality, your personality type, especially people who keep too much to themselves. They do not have social connections. They are prone to being very on edge all the time. They may develop especially anxiety disorders. Poor upbringing, and parental neglect predisposes children. Psychological trauma, severe psychological trauma suffered as a child. And let's not belittle this, because this is one of the things that we see in the mental health space coming out later in adulthood. And when you dig deeper into the history, please don't be upset when you go to see a psychologist, mental health specialist, and they're asking you deep into your early childhood experiences. It's because some of the psychological trauma suffered by children are suppressed. They suppress them, they're not able to express them at that age, and then they manifest as symptoms. They manifest in their performance in school, they manifest in how they behave at home, how they behave towards other children, how they behave to other people. Even in adulthood, maybe they might even behave that way to other adults or other children. Yeah, then of course, the poor ability to relate to others also denies you that protection that comes from having good social connections. Next slide, please. Now, some of the things that in the environment or socially can predispose is both natural and man-made disasters, a crime being either a victim of a perpetrator, even the perpetrators sometimes of the crime may suffer post-traumatic stress disorder following either what they experienced after the crime happened or the circumstances around the arrest. So both victim and crime. And remember, we must always take care of everybody's mental well-being, regardless of even their status in the society. So another thing that we often belittle is the role of culture. Some cultural practices and expectations, and I'll give an example of cultural expectation and social expectations we're experiencing currently with our generation, is where, for instance, we see or we value women as per their body form. And you find that young girls will think that to look attractive, the best way is to be thin. And it has been seen in models and teenagers, and they end up developing a mental health problem known as anorexia nervosa, bulimia nervosa, because of the societal or cultural expectations around that. So it can actually lead somebody to developing a mental illness because what the culture expects or the social environment expects of them. So we need to be very careful about how we socialize and how we perceive people in society and what we direct them to perceive themselves to be, because that failure to be accepted as who they are can lead them to develop some mental health problems. Next slide, please. So there isn't a single symptom that I mean, like I said, there are over 400 mental health problems and illnesses, mental illnesses that are defined in the International Classification of Diseases and the Diagnostic Statistical Manual, which we use to diagnose mental illnesses. There are over 400 of them. So we can't have one slide that summarizes how somebody with a mental illness looks. But some of the warning signs that somebody may be suffering, the same way if there was a chest problem, a lung problem with the lungs, I'll say probably someone with a problem with the lungs, they'll probably cough, they'll have probably difficulties in breathing. But then when you dig deeper to the specific illness, you'll hear if it's asthma, they'll be wheezing. If it's TB, they may also have loss of weight. So now again, with mental illness, it's the same. But in general, some of the things that you'll hear, it will both be physical complaints or physical signs and symptoms, and also psychological, or even how they are performing around people. So some of the common symptoms or signs that may warn that this person may be having some mental health problem is changes in sleep and appetite. And when we say changes in sleep, it could be either sleeping too much or sleeping too little. Changing of appetite is the same way, either overeating or undereating. Mood changes. They're having uncontrollable moods. The mood they express is not befitting of the circumstances they are in. Social withdrawal. Somebody decides to keep to themselves. They don't want to talk to people. They used to enjoy doing things with others. They no longer want to do those things. They have lost interest. Change in performance at work, school, or home. Problems with the way their memory, they start forgetting things, and not just the forgetfulness that is there because you're distracted, but it's severe memory problems. And you also notice they also cannot, their thought pattern may be abnormal, the way they talk, their speech is a bit off. Maybe you're not able to make sense of what they are saying, or they move away from topic. They start having, some people with certain mental health conditions may start having illogical thinking, abnormal beliefs, and unusual peculiar behavior. Maybe somebody who was previously very clean and attentive to their health, they stop even showering, they start eating what is, unusually, some of those unusual peculiar behaviors. Being too sensitive to even small stimulation is something we see in people who are experiencing post-traumatic stress. Some people, in an attempt to self-medicate from their symptoms, they may start overusing drugs or alcohol because maybe it makes them feel good. It takes away those symptoms. Some people may start experiencing multiple physical complaints. Every day they have a new complaint. Oh, I have a headache. Oh, I have a back. Oh, I have a abdominal upset. Multiple physical ailments with no obvious cause. When they go to the doctor, it cannot be found. It has actually been found in some studies in Kenya that about 25 to 40% of people who are in our general hospitals with general complaints, they're not even suffering from any obvious physical condition, but it's actually a mental health problem they have that they experiences it in physical ailment. Then some people, when they have suicidal thoughts, change in personality, these are some of the things. But like I said, there are so many mental illnesses which present differently. But generally, if I summarize it, it's changes in the way somebody is thinking, changes in the way somebody is behaving, and changes in the way their emotions are. So emotions, behavior, and thinking are the ones that are disrupted when those are some of the signs you start seeing. But then again, there may be physical signs. You may see somebody starting to lose weight. They always they want to be alone. They don't want to interact with other people. Even, so other physical things may also tell you that this person may need help. They're not okay. All right. Or even yourself, you may notice that people think that children are not affected by mental health conditions, but they also do. And for children, some of the things you need to look out for is changes in school performance. When they start dropping in school, a child who was doing well, or even an adolescent, you need to ask, is there something? Excessive worry, a child who looks, they don't want to go to bed, they don't want to go to school, they seem worried, they seem very irritable. Yeah, some of them, it's hyperactivity. They cannot finish one task. They want to move on to another task, and from one task to another, inattentiveness. Frequent nightmares. A child who was previously sleeping well. Children, when they have trauma, anxiety, it manifests a lot in their sleep. And one of the things they will notice is they may start even having nightmares and night terrors. Disobedience and aggression towards either their siblings other children. A child who was well, then all of a sudden, they become bullies in school. Temper tantrums, anger outbursts are also some of the things that can say a child may be having a mental health problem. And bedwetting, a child who had previously achieved dryness at night starts having bedwetting, or even hurting themselves. Excuse me. It's important for parents to check their children. It's common practice these days to see children, especially preteens and teenagers, cutting themselves on their arms. So they'll get a sharp object and they'll slice their wrists. It may not be deep enough to draw blood, but just cut a little bit. And they do this like to relieve some tension they are experiencing. Excuse me. So check your children, because you don't know what they're hiding behind those long sleeves they are wearing. You check, they have changed the way they walk. Are they hurting themselves? The way they are dressing. It's important to check. So we can go on to the next slide. If you don't treat mental illness, people assume that it's mental illness, it doesn't kill. But remember, if you're not, sometimes you can be a dead man walking if you're not having mental, you're not well, you know, like you're disconnected completely from the world. So you should never assume that since most mental illnesses don't kill, then they should not be given attention. Mental illnesses, when they're not treated, they can actually complicate people's life severely. People who are mental illness and they are not treated, it can lead to unhappiness and decreased enjoyment of life. And we're all in this life to enjoy. I don't think there's anybody who wakes up one day and says, I don't want to enjoy life. I just want to lead a boring and happy life. No, we all want happiness. We all want enjoyment in life. But if you have untreated mental illness, yes, you may not die, but some people end up dying from even suicide due to mental illness complications. But the unhappiness that comes, family conflicts, relationship difficulties, social isolation, especially this, people, once you're diagnosed or you're seen to be suffering from a mental illness, a lot of time what happens in our society, instead of being taken to hospital, they'll assume, now this is a difficult person, let us keep off him or her. So imagine that social isolation, yet you're struggling with an illness inside you. It's really like very, very, very bad situation for somebody. Problems with alcohol and drugs. A lot of people have ended up using drugs, either prescription or non-prescription drugs, to self-medicate their symptoms. Sometimes some patients have told me that when I drink alcohol, I don't feel anxious anymore. I'm able to face people. When I take certain tablets that I buy on the streets, they make me sleep so I don't have the nightmares. When I smoke something, it makes me not have those voices, the hallucinations in my head. I'm able to ignore them briefly when I'm high. But that is not treating. That is actually getting into another problem. So people with untreated mental illness may end up self-medicating and end up having problems with alcohol, drugs, and it makes it even more complex when it comes to management. They will miss school, they'll miss work, so they lose their jobs. They may end up in legal and financial problems, end up being poor and homeless, self-harm and harm to others, poor physical health. So you can imagine now, when in the society people dismiss, I mean, he'll not die from having psychosis, but imagine the social isolation, the homelessness, the poverty, the poor physical health, this is what ultimately will kill them. So in many communities, severity of disease is measured on the risk of death, which should not be the case. It should be measured against the quality of life. If a person with mental illness is not treated, their quality of life is severely reduced, and therefore we need to be more attentive to the needs of people who have mental illness, because most mental illnesses can be treated and people can resume normal functioning in society. Next slide, please. So I hope I've not scared you. I was just highlighting the basics, and there's a way to ensure that you stay mentally healthy. As I said earlier when I was talking about the protective factors, for every individual, the experience is different. There are some people who still thrive without by being, by keeping to their space and being not very social. So it's not a disease to be not social. However, one of the ways to stay mentally healthy is having social connections. Stay connected with others, staying positive psychologically, mentally, and in your daily undertakings. Physical activity is very important. A little exercise in a day, even 30 minutes of a brisk walk in a day, can actually take away, it builds up the feel good hormones that we talk about in the brain, and you feel good. Helping others may be surprising to you, but when you help other people, it makes you feel good. So if you volunteer to do things, help somebody do something, even something very small as helping a child cross the road in a day, or joining a club that is involved in community work, helping others, getting enough sleep and eating well, watching what we eat is very important, and getting enough sleep. And by enough sleep, it's not taking a nap in the afternoon for 2 hours and another 2 hours at night, but good quality sleep that is continuous for, we say, 6 to 8 hours in the night. It will help you. It's like when you put for those of us who use computers, if you put your computer without switching it off and turn it off, you just slap it and go to sleep. You've left that computer still running in the background. So you're overworking it. And that's how it comes. I'm told, I'm not an expert, I'm told that's how you also strain your machine with time, and it's stop being performing at ultimate level. So it's the same thing with your brain. If you don't let it sleep, you don't get enough sleep, then it means then you're not giving it adequate rest to rejuvenate, or developing coping skills. Find what helps you feel better, and then be attentive when you see the warning signs. Establish support networks. It is important to get routine medical care and checkup. And when you feel you need help, seek help. It's not a weakness to say, I need to see a counselor. I don't think I'm okay. For some people, it may be a counselor, a professional psychologist, maybe a psychiatrist. For some people, it may start as low as even your social circle. Some people go to their spiritual leaders for counseling. But if it is severe mental illness, or you need to seek professional help from the practitioners, so that we make sure we use evidence-based treatment approaches to manage your conditions, because sometimes you've known people to be treated in ways that do not approach the illness in a whole biopsychosocial way. So getting professional help when you feel you need it. So the next couple of slides, just to highlight what you need to do. When we talk about exercise, about 30 minutes, 3 days a week. Can be jogging, swimming, cycling, walking, gardening, even dancing. And it will help you improve your mental well-being in various ways. Next slides. Next slide, please. Connection, building. No, please go back. Yes, when you build relationship, you have a sense of belonging and you have a sense of self-worth. you get into a place where you feel appreciated, you feel that you're part of a bigger thing than just your daily routine. So make a habit of taking time to be either with family, be with friends, arrange some time to meet friends, turn off the TV and turn off the computer. Most of us, in this era of social media and smartphones and working from home, we end up carrying work home, and you get home, you finish eating, you open your computer to continue working, or you switch on the TV to watch news, or you want to go to your phone and turn and check on social media. But you're not connecting with people. It's not healthy. Switch off the TV, switch off the phone. Reserve some time where you say, this will be time off gadgets for me, all right? Off technology to reconnect with real people. Sometimes instead of texting somebody or chatting them on WhatsApp, pick your phone and actually make a phone call. Have lunch, speak to somebody new, yeah? And volunteer in something. It actually makes you feel, improves your mental well-being. It's not rocket science. It's what people used to do in the villages back in the days. Just having those communal things really makes you connected and engaged and takes away, it makes you feel good psychologically and emotionally. Next slide. Remember to enjoy the moments. Pay attention to the present. I get very concerned when I go to a very nice function and we are enjoying maybe a performance, even maybe a match, football match. Maybe your child is playing, maybe you're watching a movie, maybe you're watching a live concert, but everybody is recording it on their phones, but not really experiencing the moment. And I asked myself, are you really gonna go back at one point and watch those videos? Or why did you pay for that ticket? Why did you leave home to go to that event? Savor the moment. Some people, when they are eating their food, they're on their phone. They don't even know what is on their spoon when they scoop. When we don't take notice of the moments, we miss the moments, and those moments are the ones that actually help our minds, to relax. So it's the simple things that give you joy. It's not a big things. It's the simple things. Even enjoying the taste of that food, the conversation, the show you went to see, the football match. It's not the photos you're taking and posting. That one, you're just, you're fulfilling another addiction that you may not even be aware it's happening. It's coming your way subconsciously. So let's learn to enjoy the moments, because those are the ones that actually give you joy. Next slide. Trying something new or learning something new. If you're finding that you're getting the thing that is making you not have joy is because you're bored of routines, it's okay to challenge yourself with something new. Try something new. Or maybe you had an old interest. I remember during COVID, I tried to stitch, to knit a sweater, and it was very funny. Of course, I never went very far, but I stitched something. But it was interesting because I was challenging my brains to think differently, like back to the days when we used to knit booties for school. So rediscover an old interest. Sign up for a course if it's a course. And it doesn't have to be very, difficult. Just something to make your life a bit different. Embrace new experiences and see opportunities to surprise yourself. Next slide. And one of the most important things is to learn to avoid addictive habits and substances. What addictive habits and substances do, they give you immediate gratification. Human beings like to feel good, as I said earlier. And for some people, the sooner it comes, the better for them. And sometimes something like watching a YouTube short may give you quick happiness, but then with time, you get hooked to that habit that I'll just be watching YouTube shorts, I'll be going on Instagram, Facebook, social media all the time. So it can become addictive. and others it's gambling. So there are many addictive habits. Not necessarily in the past we just used to talk about substance addiction, but there are also habits that can actually become very addictive and even affect your brain negatively. So avoid addictive habits, avoid addictive substances, and also be aware of signs when you start thinking this is affecting me, so I need to stop it. All right, next slide. Oh, well, I hope none of you in the audience is wondering why we are talking about this, but some people ask us, why do we even talk about mental health, mental illness? That is not a problem for me, it's for other people. People believe that mental health problems are rare and they affect other people. The truth of the matter is that mental health conditions are quite common. And it is estimated that 1 out of 8 people in the world will suffer from a mental health condition in their lifetime. So if you in your lifetime, maybe it may not necessarily be a severe mental health condition, but it's quite common. 1 out of 8 people will suffer from it. So it is something that is common and that we need to be on lookout for. It is estimated in Kenya, 1 in every 10 people suffer from a common mental health disorder. And 1 out of 4 people attending routine primary health facilities, people who go to the dispensary, the ones who keep going back and you cannot really put your finger. The doctor has done all the tests. They can't put a finger on it, what it is. Further investigations have found that they had an underlying mental health problem. And remember, I said there are many disorders. It doesn't have to be the severe form, the psychosis, the depression, major depression. It could be anxiety disorder, mild or moderate phobias, post-traumatic stress disorder, eating disorder. So 1 out of 4 people attending routine primary healthcare facilities have a mental illness. So we need to be attentive to the warning signs. More than 700,000 people die out of suicide every year globally. So that's quite a big number. And suicide is the 3rd leading cause of death among 10 to 29-year-old persons. Again, something that we need to be alive to the fact that mental health illnesses are common and can begin at any age. Most cases actually begin between the age of 10 to 24 years. And unfortunately, they are only diagnosed much later in adulthood. And it's these children you start saying, this child is dropping in their grades, especially when they're in Form 2 for the Kenyan system. From around the age of 16, they have started experimenting with drugs. They're having conduct disorder in school. They are skiving classes. They are stealing things in the house. They are becoming bullish to their friends and colleagues and fellow schoolmates. You just see behavior change. Then a child who maybe scored an A or a very high marks in their Form 4, when they join campus, they dip in their performance, they start changing. It's because most illnesses, the onset is around that age. But since we are not alert and we are more, because society is quick to look into, this is just a behavioral problem. This girl is just being difficult. Let's beat him. Let's deny him privileges without exploring deeper what it could be. Yeah. I usually ask, if your skin started darkening or you noticed your child's skin is darkening on one side of his body, would you now say this child is just sitting too much in the sun? Or would you probably take them to the doctor to check why is the skin darkening on that side? All right. It's the same thing with mental illness. If you see your child's behavior, emotions, and the way of thinking is changing, they're starting to experiment with drugs, take them also for an assessment with a specialist to just check whether they are in the early stages of onset of mental illness. Because when if it presents late, then managing it becomes also difficult. A lot of the patients we see in our healthcare facilities who are being brought for mental illness, management, they're actually in the advanced stages. And therefore, that is why it becomes quite complex to treat. It's like taking somebody who is already in stage 3 or stage 4 of cancer for treatment. Of course, you'll need to be more aggressive in treatment, and the outcomes may not be as good as if they came very early. So the same thing with mental illness. If you start seeing the subtle signs, just take them to a specialist early enough for assessment. It's better to be assessed and told this is nothing to worry about than to wait on until they are 30, and that is when they have already lost the years of their lives where they could have been fixed and moved on and become productive in a society. Next slide, please. So I think I've all along been debunking some of the myths, but I want to just highlight a few, but there are quite a number. And in the subsequent webinars, because one of the reasons of the webinars we're doing is to reduce stigma around mental health and mental illness, you'll hear most of the other presenters repeating these myths and debunking them, because we want people to know the facts and stop spreading the rumors. And for one fact I must start with, because it is so Kenyanized, people have always said and asked me, Doc, you work at Mathare, is it true that if I bring somebody who is mentally ill, you'll actually pay me? That is a very stigmatizing statement. It is not correct. It's very stigmatizing to think that you'll be paid to bring somebody who is sick. We will attend to them even if you don't have money to pay for them, but we will not pay you. It's not a reward. It's not something you've rescued. It's not like you rescued an animal and you're bringing them to the zoo. No, please, let's stop saying that. It's not even funny. I hear it spoken about very casually and people laugh about it. It's actually offensive to persons who are living with mental illness, their caregivers, and even us as the mental health professionals. So that is one myth I've debunked, that is a Kenyan myth. Now, and also another thing that is a myth now to destigmatize the institution is, if you come to Mathare Hospital, you'll be greeted by green lawns, nice walkways, people who walk and will say hello to you, not people who will chase you around. It's a safe institution because people who work in there, even if some of them have mental illnesses, they're enjoying mental health because they are coming for treatment. So mental health don't affect me. Mental health problems don't affect me is a myth that is commonly said, especially people in certain socio-economic status. They assume that it's a condition of people of another socio-economic class. Mental health problems don't discriminate. They can affect anybody and they're quite common. But everybody who is affected can be helped. Another thing is that people with mental health problems are violent and predictable. This is far from the truth. Actually, most of the people with mental illnesses are not violent. And the few who are violent, it's acts that are attributed to either what they're experiencing, and the violence will be a way of trying to defend themselves from what their experience is, especially those who hear voices that tend to threaten them. We call them hallucinations. So they feel threatened and they will act violently as a way of protecting themselves. But it's a very small percentage of persons who will do that. So it's usually unfortunate that people are chained and tied down. Yet simple compassion and show of love to these persons can actually de-escalate a situation. A lot of times we don't even de-escalate violence in the hospital with tying or medication. It's just the way you treat somebody. If they don't feel threatened, because there are voices in their heads that are telling them, so-and-so want to harm you, so-and-so want to harm you. Then you come and tie them down. Obviously, they'll feel threatened. But again, majority of violent people are people without mental illness. It's not people with mental illness. That's a fact. The other myth is that people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. This is far from the truth. If you Google, there are many very successful people in the world who have succeeded and made great inventions, great contribution to our world as it is now, yet they still live with mental health problems, mental illnesses, but they manage them. So if you're an employer and you think that this so-and-so got a mental illness, so I cannot hire, they cannot be reinstated in their job, please rethink it. Unless the doctor has said this one has actually reached a point where they are not able to work. Most people with mental health problems, once they are managed, they are able to be productive as other employees. The other thing that most people think is like, this person is pretending, snap out of it. No, it is not something you snap out. You need help, you need treatment. And it is a lie when we say there is no hope for people with mental health problems. There is hope, they get better, and some even recover completely and resume their normal functioning. So finally, Memphis, if you come across somebody who is affected by mental health problems, please reach out to them. Let them know that you're available to help them. Be compassionate. Don't be discriminative. Don't run away from them. Help them access mental health care. For people who are at risk, learn and share with them some of the facts about mental health. And especially when you're in spaces where people are spreading myths, please help them know what the truth is. Treat people with mental health problems with respect, just as you would treat somebody with cancer, somebody with high blood pressure, somebody with asthma or malaria. And do not label them. Don't label people ex-madare. Don't label people cheesy. Don't label. It is, as much as we casually want to use those terms, they are quite offensive and they make people be unable to disclose even when they are suffering from mental health problems. So I want to summarize this, Memphis, the next slide, by repeating that mental health is a state of mental well-being that enables people to cope with stresses of life, realize their abilities, learn well, work well, and contribute to their community. While a mental disorder is a disease or an illness that causes significant disturbance in a person's able to regulate their emotions, their behavior, or their way of thinking. Well, mental wellness, when you talk about mental wellness, it's about preserving your mental health. It's about preventing mental illness. It's about coping with life's adversity and being resilient when you face stress. So these are some of the steps you can take as a parting shot to manage, to attain wellness. Thank you very much for your attention, and maybe over to you, Memphis.
Wow, Daktari has done justice to this presentation, and thank you so much, Daktari. That was quite informative, and I would like you to pat yourself in the back and tell yourself how well you've done. And we are around 1.3 people. I would like us to give emojis, just of claps, of celebrations, and all that because of the justice Daktari has done to the presentations. And I think as we have all seen, she's a powerhouse when it comes to mental health. And you can imagine that is what Madari just offers when you come there. So, Daktari, have you pat yourself in the back because we need to reward you, and that is one way that we do it because we can't come and do that.
Yes, and I'm just receiving all the emojis, the love, the
Please
claps.
receive them. You have done justice, and we just want to thank you for doing that. And I just want to inform us that this was introduction to mental health, introduction to the topics that we have lined up, and you wouldn't want to miss. And I am seeing so many questions, and our time is up. But well, I will let Daktari take a cup of water and then come back to be able to take the questions. But probably just to be able to take the questions. But maybe a disclaimer to the presentation Daktari has done. Most of the time when we do these presentations, then someone is seated somewhere, you are listening, and you start to look at the symptoms we have talked about and you start to tick them for yourself. You're like, I think I have this, I think I have that. Or you go and start diagnosing somebody you have seen coming out with such. So we dissuade us from doing that, and we encourage us to be able to seek help. If you feel like you are going through whatever it is, or you have seen somebody going through similar just symptoms, then it is better for you to seek professional help. And I can't stress what Daktari has said. And she has also stressed much, and I can just echo what she said. Marking this month, the theme is movement for mental health. So she talks about exercise, and you need to move for mental health. Walk, jog, do that. You have to be able to fulfill that theme for the month. And another thing that she told us is that it's never that serious. It's never that serious. Just be, just live, exist. And so without taking much of the time to summarize what Daktari has said, I think we can go to the comment section, and somebody says, wow, nice presentation. That is Daktari. And Kevin Kiama has also given so many just being able to echo what Daktari has said. And he's saying that mental health is the only docket in medicine categorized, described, and approached based on a conglomerate, that one, not know, similarities of signs and symptoms as compared to other medical departments, which are approached based on etiology and pathogenesis. So I see it's question marks, but I think it was a comment. And then somebody is asking for the notes. We will see whether I can do that. And then, can dementia occur in the mid-30s or so? Daktari, you will answer that when he's asking whether dementia can occur in the mid-30s or so. And then, is there going to be a certificate of attendance for everything? So we're going to get back to you on that. I think when you were registering, you left your email. So we're going to get back to you on the same. And then Rachel is appreciating the slides that Daktari has presented. And then you're asking whether, she's also asking whether it's possible to get a soft copy for the mental health material. You can share to the MU University Health Science Campus, maybe to my university. Okay, maybe she can repeat that because I cannot be able to get that. Or she has given an email for us to be able to share that. We will see whether this is possible from our host. And Wilson is saying that he's a healthcare profession. He's a healthcare profession, and for almost more than 6 months, he's been having an outburst, very emotional, irritable at work, withdrew attending church, weight loss, and etc. and all that. And for Wilson, I think for this one, you say you have visited a counselor, and still, okay, I am sorry to read that. But I think you can get in touch with us for us to be able to tell you exactly what your next steps are going to be. But as I said, it's never that serious, and just come and let us be able to talk to you about what you have asked. And then Liz is also asking for the slides. The recording is also needed, so we have your emails, and we may get in touch with you. And then there is something that an anonymous is saying, that how we connect with others in today's world when people have all these many rules around them. No calls, no texts, don't interrupt my me time and workmates and all that. So I think Daktari has given much on that about how to be able to connect, but more is going to be coming in the next series of discussions, and I wish that you can be able to attend. And where you can get these slides, wow, I think I will let the host be able to take that. And how does someone manage mood changes in diabetes too? Okay, Daktari, you can take that. And thanks very much. Then most insurance companies don't pay claims for conditions attributed to alcohol use disorder. Isn't this a form of stigma? Or secondly, can the law intervene? Daktari will take that, but we are still just taking alcohol away from being ugonjwa ya kujitakia to being that mental illness or mental disorder. But the Daktari can be able to talk about that again. and how effective is family therapy? I think Daktari can be able to take that. Then it's informative. Thank you. Thanks for the insights presentation, Dr. Karanja. Thank you, our sister. And please share her contact. Yes, we will do that, but with her permission, and probably you can get in touch with us to be able to get that. Then any contact can refer someone to be seen for mental, any contact to refer someone to be seen. If you refer them to either KNH or to Madari, we can be able to see them. And just what we are doing right now, being able to present to each and every person, and even being able to partner with KNH, we are destigmatizing Madari. So if you walk in, you will get all these questions that you're asking about, and then we will see whether we'll be able to share to this slide somebody else. And why is it difficult for medics to seek help in mental crisis? I think this one, Daktari will be able to take it, and she can tell us whether she seeks mental, whether she also goes seeking for help when she's down. Because as she said, we are all candidates of mental illnesses or mental ill health. So CPD points I have never received for this year. So you left your emails, and that is going to be done. Share these slides. How do I assess mental health among members in my organization? Any tool you could recommend. And Grace, unless you are, for you to be able to do assessment, you need to be a professional recognized by different bodies. So if you are that, then there are tools that can be able to assess people that are having difficulties, or just normal people, or just somebody you can be able to assess. But that one needs a bit of consultation or a bit of elaboration. And then as Daniel, you want the slides. This is also recording, send the slides. I think Daktari can take the questions that we have already read, just to be able to finish this. And can Daktari talk about emotional abuse? In our subsequent coming sessions, we are going to be talking about most of those disorders, because this was just an introduction. Yeah, the presentation has just made me see some things in real situations out here. Yes, they're there, but unless you're a medic and you cannot be able to diagnose your family, your workmates, your people with you have relations with in any form, you may not be able to diagnose them. You could be seeing those symptoms, but the best you can do is to refer them for help. I would also like to have the recording. We will see whether we can organize that with
apologies for interrupting, Memphis. This is Nelson.
Yes.
I can see there's so many questions on the recording on the slides.
Yes.
Just to inform you that all of our sessions are recorded and are uploaded to our YouTube page. So if anyone would like to revisit any of the sessions that we've had, including this one, it will be uploaded to our YouTube page, which is KNH at KNH Research, or you can search for KNH UN webinars on YouTube, and you can get access to the recording. I guess that can deal with that for the so many questions that have been coming. And also for the CPD points, kindly check on your reminder emails. There is guidance for each and every cadre that we do provide CPD points for. You will be seeing your updates. We normally update them according to according to each cadre and how we will issue you your points. So kindly check on that as well. And we can proceed now with the Q&A, Memphis. Sorry for the interruption.
No. Thank you, Nelson. That was insightful. And the last question, the question that I'm seeing here is, what are some of the common stressful life events that are experienced, especially for young people in the age bracket of 20 to 35? That is going to be covered in our subsequent webinars. But if Daktari will have time, she will be able to answer this in. So kindly, Daktari, take the floor. Thank you very much for that.
Thank you, Memphis. I will attempt to answer as many I can in the short 10 minutes we have remaining for the webinar. I will start by stating the question that can a person at the age of 30 develop dementia? It's rare, but sometimes it can happen in that age group. It's a rare occurrence. It's more common in advanced age, but dementia is caused by various reasons. It's not just it's not an age issue only. So there are many other types of dementia, and they can occur even in young people, but it's quite rare. Social withdrawal from introversion, how do you differentiate? When somebody has a personality type of being introverted, that will be noted from the word go, from their early years and youth. But when you talk about social withdrawal, is somebody who changes now. They were probably outgoing, they used to be normally talking to people. They used to like certain things, maybe had certain hobbies, but suddenly or gradually they withdraw and they stop interacting. So that is what we talk about social withdrawal vis-a-vis introversion. How do you connect people in this age and era of how people are relating to each other with the digital spaces? You have to be deliberate. That is the key. You as an individual have to be deliberate, and you cultivate a culture around the people you hang out with, to be deliberate, to connect with each other. I know it's hard with what's happening with the digital era, but be deliberate and make sure that it happens even with your social networks. How do you manage mood changes that occurs with diabetes? I believe there are physicians around, they'll agree with that. People, when their blood sugar are not controlled, as well as even people with other hormonal and physical conditions, when they're not well managed, it can affect the brain functioning. So it's a matter of managing the diabetes, but then again, also providing the psychosocial support for somebody to understand their illness. They could be having the mood changes because of the stressor of knowing they're living with a chronic disease, and they have not been psychologically well, counseled or continuously given psychological support. I have experienced in some spaces where when somebody is diagnosed, the initial counseling is what happens. You're counseled about, this is what you'll eat, these are the possible treatment mechanism, these are the risks you're likely to face, but the counseling is not ongoing. So for anybody with a chronic illness, we really encourage that no matter even if it's well controlled, keep checking on the persons and keep providing that psychosocial support, because they are going through something different with their health and their different fears they face every day from the illness. Does family therapy work? I'm going to broadly say that therapy works in general. Family therapy, individual therapy, group therapy, counseling, different kinds of psychotherapy, they work, especially if they are provided by somebody who is trained to do that. Sometimes we confuse the social counseling for family therapy. There's some difference. So when people are called for family therapy, it's not an event. It's a series of sessions that are administered, more like a dosage form. So when it's done properly, family therapy actually work, and even different psychotherapy actually work. We have treated people who even have anxiety disorder, depression, just purely on psychotherapy without administering medication, and it worked. Is walking a physical exercise? Walking is physical exercise. Dancing is physical exercise. Can somebody be cured from mental illness? Like I stated in the presentation, some mental illnesses, people actually get treated and get full recovery. Majority of people who are treated of mental health conditions, they are controlled fully and they're able to continue with their functioning. Why is it difficult for medics to seek mental health? I assume it's help when they're in mental health crisis. Well, I would say it's not just medics, but majority of people in the community shy away from seeking mental health support because of this associated stigma, and because a lot of times it's seen as a failure in our society. But we are coming out and encouraging people to say, you need to take care of your mental health the same way you go for your annual pap smear, for instance. You go for your well woman checkup, well man checkup. It's not a weakness. It's okay not to be okay. It's okay to have those moments in your life, those crises. And it can only be helped if you actually seek help. Now, there was a question also about a person who shared their own experience. I would encourage you that you perhaps try and talk to somebody about what you're going through. It is it's good that I appreciate you for sharing that. It is okay to speak to a professional. If you don't have somebody near you, we shall perhaps maybe Memphis, you can side chat them and give them my number. They can reach out to me and we can have a conversation. Finally, and I know I may not have exhausted all the questions, what are some of the common events that are considered stressful life events, especially among young people? As we said, it may be discussed later, but just to elaborate here, people assume stressful life events are just the negative life events. Of course, most of the times, when you're going through school, it's stressful and looking for jobs, financial, being broke, relationships, but also sometimes even having positive changes in your life. Getting a new job can bring you new stresses that you did not anticipate. Having new money, some people say even money can bring you stress when it comes your way. So it varies from an individual to individual, and it depends also on your coping skills. But a lot of times it's associated with for young people, it will be associated with relationships, to be associated with school, finding jobs, and other things like that. I am very sorry time was not on, has really gone. I know there's many more questions out there. And I hope even in the subsequent sessions, we'll be able to give more information around mental health. And I hope that all of us here are going to be advocates of mental health moving forward. I really thank you for your attention, and I've enjoyed talking to you all. Memphis, over to you.
Thanks, Dr. Because of time, we encourage that we be tuning into these webinars. We are going to be dealing with very many other topics and in depth. So you can imagine if Dr. just did the introduction, then what we have for you is enough to just be able to help you balance your life in whichever way. Someone is asking, which profession do you talk to when in need to talk to someone? Psychologist, psychiatrist, marriage counselor, and who? We are all trained in different fields, but if you can talk to either of them. And if they are limited to the resources of helping you, then they refer you to the correct person. Like if you go to a psychologist and they realize they have a difficulty dealing with marital issues, then they may refer you to a marriage counselor. Similarly, if you talk to a marriage counselor and they realize yours is more clinical, it's more for a psychiatric review, then they will refer you to a psychiatrist or a psychologist. So do not be stuck. Just go to any one of the people that you have mentioned and they are going to assist you. So I hope that I have answered that. Then someone is also asking, any studies linking chronic illnesses like high blood pressure in young people with mental health illnesses? Charity, do you have an answer for that as we wrap up? That if there are any studies linking chronic illnesses like high blood pressure in young people with mental health illnesses? Yeah. Okay. Charity, go.
There's none on top of my list that I can quote, but I would encourage them maybe to check in their various platforms, the resource platforms, whether there's any studies done locally on that. Yes.
Thank you, Dr. And I would also encourage for these studies, and when you are Googling or when you're going to find out on these studies, let it be a legit site so that you're not going to die when you find some of the things that are being talked about in blogs and in these other funny websites. So I think we can wrap it up there. That was it from us. And we can leave at our own pleasure. I wish I can leave my number I am not finding the person that the Dr. has asked to be give. Nelson, kindly assist me to give a number to the person that was asking for help so that I can be able to go. Thank you very much for coming. Nelson, back to you. Asanteni sana.
All right. Thank you so much, Memphis and Dr. Mercy, for the quite informative session. I must admit that we have stayed glued to our screens following all that you have been teaching us today. And we will be looking forward to the subsequent sessions that will be coming up. And to our participants, thank you for also joining us today and taking part in this impactful conversation. And just to inform you, on your screen, we are sharing our session that we'll be having tomorrow. It is for gender-based violence, so kindly tune in, and also you'll be able to join us as we have this conversation around GBV in Kenya and beyond. Thank you once again for being with us. We will be back with our Mental Health Awareness Month series. You will be receiving notifications through our normal channels, that is email, WhatsApp, our social media pages as well. You can see them posted on the poster there. Please feel free to follow us and you will get access to our latest updates in our events and programs. Thank you once again to our Mathari team, Mathari National Referral Hospital, for being with us today and also taking this journey with us on Mental Health Awareness Month. See you tomorrow, and good night.